Off National Community Health Centers Week is our dear friend Bill Wypyski from the Center for Family Health. Welcome back.
Thank you, Jennifer. I always appreciate you know how to say my name correctly. That's a joy. Not that Bart doesn't. He does a good job too.
I know you, I love you, but I still get nervous when I see it. Like, am I going to screw it up?
No.
It's not that hard.
It's not.
No. But I love you, and I'm so glad that you're here. And tell us what we can look forward to this week.
Yeah. So beginning of next week, we have something called the National Health Center Week, and this is something that's done throughout the whole nation, and it's in celebration and recognition of all the community health centers and what the services that we provide, the people that we help, and the communities that we serve. So very exciting. We have a full week of activities, and we're looking forward to letting people know about it.
Awesome.
Yeah.
So each day of the week, something different you are highlighting?
Yes, yeah.
Is there a CEO day?
You know, there isn't, and that's okay. I like to stay humble, maybe behind the scenes a little bit. So that works
get out
well.
there and shake some hands and kiss some babies, Bill. Come on.
I can do that. All
right, what are you kicking off with? What are some of the events?
Well, we've got a number of events that are going on, and it's technically Sunday through Saturday.
Okay.
But for the most part, the actual activities will be during Monday through Friday.
Okay.
But we're kicking off. I'm looking at my notes. But first and foremost is something called public health in housing. Sometimes what we forget are the folks that are living in public housing, and we want to bring a light to that.
Okay.
So we will be doing some what they call Our Neighbor Keeper, and we're going to be internally doing a drive where there's furniture or other things that can help put in people's homes, which is really great.
Yeah.
It's nice to get an apartment or a home, but how do you furnish it? How do you make it feel like a home? So that'll be number one.
Okay.
I'll whip through these other ones here. Number two, Monday, August 5th, we'll be doing healthcare for people experiencing homelessness. Something I like to mention is that we don't just say homeless people. We say people, they're people first, and they are currently experiencing homelessness.
Okay.
We like to keep that dignity for folks. And we'll be holding internally at our place a hygiene product drive.
Okay.
Our staff, board members, folks in the public can bring in stuff. We will then bring that to the local interfaith shelter. Should I keep going?
Keep going.
All right, number three, Agricultural Worker Health Day. We are going to be holding another drive, a canned food drive to collect and then put that into our pantry.
Nice.
We actually have a food pantry at the health center. If someone comes to our place, medical, dental, behavioral health, what have you, there's still an ability if someone is in need of food that day, we have a food pantry.
Wow.
Yeah, it's great. It's really great.
Beautiful
Yeah.
resource.
Yeah. Healthcare. Healthcare is a lot of things, but healthcare is also being fed.
Yeah.
And we promote that.
Yep.
Number 4, Patient Appreciation Day. So our outreach team will be in the lobbies of both our main clinic as well as our dental clinic, outreaching to folks, getting them set up if they need with Medicaid applications.
Okay.
We'll be giving some giveaways and really appreciating and supporting the folks that we work for.
Nice.
We work for our patients.
That's beautiful.
Yeah, and then rounding out, number 5 is Stakeholder Appreciation Day, and we're excited. We're going to have Mayor Dan Mahoney with us for that day, and he's going to read a proclamation about community health centers.
Oh, cool!
And I saw him twice, and he's actually excited about coming. So a shout out to Mayor Mahoney.
Nice.
Which is great. Rounding up the week, we have Health Center Staff Appreciation Day. You know, we could not do what we do without our close to 270 staff members.
Wow.
And they are an amazing crew, whether it's the front desk staff, our providers, our administrative staff, they are amazing. They stay true to our mission, and they work hard to fulfill kind of like that purpose that they have in their hearts to work at our health center. And then last but not least is we're going to celebrate and bring honor to our children's health, the children that we serve, and that's going to be done at Loomis Park on Friday from 11:30 to 1 p.m.
Nice.
And it's possible you guys might be there.
Oh, great.
Yeah.
Oh yeah, welcome.
Yeah.
I think a lot of people will be going to the Center for Family Health next week for parking.
Yes. Oh, yes. Can I say, oh, goodness. So, yeah, we are going to be helping the local county fair with parking. and you'll be able to park in our parking lot. There will be a slight charge for that. We'll have staff out there and trying to balance out folks that need to park there because they're getting care versus people parking there for the fair. Last year I was a little overwhelmed, but I'm prepared this year.
Well, I parked there last year, and the staff was super helpful and kind, so it was a really nice experience.
Yeah, excellent, excellent. That's great.
What's the progress on the new clinic downtown and the drive-through and all that?
We're really getting excited. It's been an amazing shift in creating and doubling the size of our walk-in clinic. We are rounding the bend with that, and we're hopeful that we'll see it open by mid-September, if not a little bit sooner. However, we are doing a ribbon cutting. The chamber has been very supportive of us. They're coming with I'm doing this big scissor thing that you won't want to get in the middle of. And we're going to be doing a ribbon cutting on Tuesday, August 27th from 4 to 6 p.m. People are welcome to come by for that event. And you'll get a quick tour of the place before, patients are there and all that good stuff, get a sense of what's available. Very excited about that. And we're excited about the drive-through as well. For folks that don't want to get out of their cars or for whatever reason, have ability to drive through, pick up their meds, and keep on going.
I had a question about that pharmacy. Does it only service those that seek care there? Or if my doctor's somewhere else, can I have the prescription called into your pharmacy?
You can have it called in. When I moved here from Iowa, it was only an in-house pharmacy. This is a retail pharmacy.
Perfect.
So folks can get their meds even if they're not our patients.
Perfect.
Not that we don't want them to be our patients, but
it's just so convenient because there's nowhere else right downtown
exactly.
to do that.
It's a
so
good location.
I'm really happy to hear that.
Yeah, it's a really good location that way. So yeah, it's really exciting that I've been here for a little over a year, and so many cool things have happened. We're building on our laurels from the past, and we're moving forward. And we're just, as I said earlier, joining the other 1,400 health centers throughout the nation. And we're just excited to be there and be there for this community.
Yeah, we appreciate you very much.
Happy anniversary.
Yeah.
Yes.
You were one of the first people that Bill met when he came to Jackson.
Yes. I was in need of a place to live. And so I did ask the chamber, blanking his name, the gentleman who helped me. He's always involved with all the balloon festivals and stuff down in the chamber.
Oh, yeah.
And he gave me Jennifer's name and contact information.
Tim Booth.
Yeah.
Tim Booth, that's it.
Yeah.
That's it. Yeah. So I've been happily living out at, this is a shameless plug, I guess, but out in one of the lakes.
Yes, he's enjoying lake life.
Yeah. So I'm very happy, and it makes me happy to be here in Jackson.
Yeah.
Well, great. We love having you here, and happy National Health Center Week, Community Health Center Week.
Thank you. It's a great opportunity to really make sure the public, again, knows we're there. And something I said to a person earlier this morning was, this is Jackson's Community Health Center. This is this community's health center, and we need to be there and be responsive to the needs.
Yep.
And we try that every day.
Well, we appreciate it.
Thank you.
The efforts are
Thank you.
extraordinary.
Thank you.
Thank you.
It's a jewel. Thanks to Bill Wypyski from the Center for Family Health. More of the morning show after this.